Imagine walking into a corner store in your neighborhood only to find rows of chips, soda, and processed snacks, but no fresh fruits or vegetables. For many families in and around Boston, especially in lower income neighborhoods such as Roxbury and Dorchester, this isn't an occasional inconvenience, it's a daily reality. These are communities living in what's known as food deserts, urban areas with limited or no access to affordable, healthy food. As a student who has researched many local food justice organizations along with urban food systems, I've seen the effects of food deserts on Boston's underserved neighborhoods. Food deserts in Boston represent a major public health issue that deepens inequality and limits access to a basic human right of nutritious food. But through targeted outreach and community-led action, we can begin to close the gap on food access. Today, I'll first describe the scope and impact of food deserts in Boston. Then I'll go into our target audience and how our messaging with our food campaign has been tailored to reach them effectively. Finally, I'll walk you through the campaign we launched to bring more nutritious food access options to Boston. According to the Boston Public Health Commission, residents in low-income neighborhoods are 4 times as likely to lack access to fresh produce and whole foods than those in more affluent areas. For example, in Mattapan, there are significantly fewer full-service grocery stores than in neighborhoods like the Back Bay or Beacon Hill. Instead, residents rely on small convenience stores that have very limited healthy options, often at higher prices if they do have them. This lack of access has serious consequences. Higher rates of obesity, type 2 diabetes, heart disease, they've all been documented in these areas. It's not because the people don't want to eat healthy, it's because they literally cannot afford the food they need to make healthy choices. In essence, these communities are being nutritionally underserved and structurally marginalized. Our primary audience includes residents of affected neighborhoods, especially families with children and elderly individuals who are often most impacted by food insecurity. We also target local business owners and city officials who have the power to influence food availability. To make our campaign resonate, we used community-centered messaging. We conducted listening sessions to hear resident stories and concerns, which shaped our approach. Instead of talking about healthy choices in abstract terms, we focused on food culture, family, and survival as a whole. Our materials are bilingual and accessible, and we use social media, neighborhood flyers, and school newsletters to spread the word. So our campaign that we launched is the Boston Fresh Access campaign, and it has 3 components. First, we organized a mobile farmers market program that brings fresh produce directly into underserved neighborhoods every weekend. The produce is sourced from local farms, and prices are subsidized to ensure affordability, because that is one of the main components that we want here, is people to be able to afford this. Second, we partnered with corner stores through a Healthy Store initiative. We help them stock fresh items and provide refrigeration units, marketing support, and training. Lastly, we held a community nutrition services campaign led by local chefs and health workers, which promote healthy cooking on a budget, mainly informative. This campaign is about meeting people where they are, physically and culturally, and giving them real tools to reclaim food access. Food access is not a luxury, it is a necessity, and it's time we stop treating it like anything less. So today we discuss the severity of the food deserts in Boston, the importance of targeting messages to the communities that are most affected, and the concrete steps taken by the Boston Fresh Access campaign, and the steps that will be taken by us to bring nutritious food into people's lives. Food deserts in Boston are a silent crisis that continues to harm thousands. But through culturally sensitive outreach and on-the-ground action, we can reshape the local food landscape and ensure all residents of this city have access to what should be a basic human right. A city as vibrant and diverse as Boston should not allow zip codes to determine whether a child eats vegetables or chips for dinner. Real change is very possible. When we listen to communities, act together, and prioritize food justice for all, this change can actually occur.